we go. Hello, Jaya. Dr. Jaya Rachwani is an assistant professor and director of the Motion Analysis Laboratory at the Department of Physical Therapy, Hunter College, City University, New York. She is a licensed PT, physical therapist, specializing in pediatric rehabilitation. Her research focuses on postural control, motor learning, and early intervention. Welcome to We Can Learn to Learn vlog, which is for parents, for students, for teachers to understand that the body plays a major role in our capacity to learn. And yet, we don't always know what to do when we see students who are slumped over or who can't follow sequences in movements. And of course, you work with a very young, early population, but I'm sure there are red flags that you see right there that's why they're referred to you. And so I'm wondering if you could explain what you do in your lab. What kind of people come to your, kind of young ones come to your lab, and what do you do with them?
Yeah, so thank you for that introduction, Mina. So in addition to me being a professor at Hunter College, I'm also an early intervention provider. So I see babies and toddlers from the age of 0 to 3 years, and they are referred to me because there is a delay in their motor skills.
Mhm.
Many of them are not diagnosed. It's just a simple delay, and then they end up getting diagnosed with a certain condition.
Yeah.
Many of them are not diagnosed. There is just simply a delay because of their environmental situation.
Yes.
Um, so I am an evaluator and a therapist as well.
Yeah.
And the types of patients I see are can range from not having any diagnosis to having spina bifida, cerebral palsy, um, genetic conditions,
Yeah.
uh, and things like that. Yeah.
Yeah. So why would somebody bring their child to you without a diagnosis? I mean, how do they even know about you? I mean, I graduated from Hunter College, I think before you formed the department. But so how would anybody know? Would it be the hospitals? Would it be the obstetrician? Would it be the,
Good question. So the early intervention program
yeah,
is available in every state.
right.
It's a federally paid program.
Yeah,
And so every pediatrician knows about this. So they are the ones who typically make the referrals when they see a certain delay in in the child's motor skills.
yes,
And then once parents are referred, they then make the call and they are then um, assigned to a service coordinator who then manages all the therapists
right,
in coming in for doing the evaluation or therapy.
right, right. I mean, I'm in EI and I go to people's homes and I provide them with early intervention. But nobody ever told me that there is a department where where young ones can go and receive rehabilitation. Is there like a certain severity of condition? Like, what are parents to look for with when they're observing their child? Is it the fact that they don't open up their hands? They're always in fisted conditions. Is there like a milestone chart that you recommend for them to look at? Is it that they're not crawling, or what is it?
Yeah, that's also another good question. It's typically the most basic skills which they are lacking, and that's why parents get concerned. For example, by if they see that their baby's not rolling, or if the baby's not sitting by the age of 6 months, they typically get concerned. Or if they're not walking by the age of 12 months, that's a big milestone, which directs them to making a referral.
Yeah.
Um, when high tone, which is an example you just gave of hands being fisted, typically is also something that they might be concerned, but typically a question they would ask a pediatrician
Right,
if there's no underlying diagnoses.
right.
So um, if they're born healthy and there was no abnormal birth history,
Yeah.
parents typically get concerned when there is a delay in the basic milestones.
Yeah, yeah. Babies are so cute. And our expectation of babies are like, okay, they've got their fists. Ooh, got their fists. What's the big deal with the fists? So, for example, I'm working with a young child who's now turned 4, but he would not open his hands to hold a crayon mark. And and his parents are so on top of the game. They had him evaluated when he was very young. He has a diagnosis of being on the spectrum, ASD, and autism. And and yet when they went for the evaluations, they said, "Oh, he doesn't qualify for PT because he can climb the stairs." And when I saw him, by the time I saw him in a preschool, I just noticed there is something not right. First of all, he was like sitting like this, his head back like that, his shoulders forward, hunched back, like barely. He was just so exhausted, it seemed. And of course, sucking his thumb furiously most of the time. But when he got, and this particular school has 1 hour of physical movement with music. When it was that time, the kid could not stop moving. He was just really into it and would jump around and would not have control to stop, to freeze, to regulate the various types of movements, sequences of movements and gestures just not there. And so I said to the parents, there's something going on there that he really needs to be evaluated. They said, but they told him he doesn't need it. I said, please, for my sake, you know, ask your pediatrician. And so finally the pediatrician relented and gave her a referral for evaluation. They came to evaluate him and they said he's severely delayed. So how does that happen?
Right,
You know,
right.
that's what I'm trying to communicate, that sometimes pediatricians don't recommend it. And sometimes, the parents, they don't pursue it necessarily, thinking, he'll grow out of it or she'll grow out of it. Can
Mhm,
you give us a sense of urgency of how unmet needs
mhm.
in terms of motor skills can affect an individual in school and after?
Well, um, motor skills are highly correlated with cognitive skills. That we know for
Mm,
sure. So, the earlier babies achieve their more milestones, that has a impact in their cognitive skills and in their language skills as well. So, you telling me that there was a child who didn't get wasn't first eligible for services. Yeah, it is a huge problem, and that happens very often, and it might very well be because of the type of standardized assessment that the evaluator might have used, or because there is day-to-day variability in how the child performs on day one of the assessment and then changes on day two. That might have an impact as well on how eligibility is determined, which we should all be aware of. Um, we as clinicians should be using valid, highly reliable, and responsive type of assessments to truly examine whether the child has a delay or not.
right,
Um, right. And then, we should also take into account that day-to-day variability that might occur in the child's performance. And yeah, of course, if there's a delay in motor skills, that would have a huge impact in other domains that are beyond the motor aspect.
Yes.
You think about it, everything is motor, like in
Right.
school performance,
Yeah,
right? Just having adequate posture has an impact on where the child is looking at in the classroom,
exactly.
has an impact on their fine motor skills, because if they're in a more slouched position, like how you were describing before, that has an impact on how they use their arms and hands when writing or
Cor-
when building things, right?
Correct. Yes.
And if that is being obstructed, that would then have an impact on their speech or in their cognitive performance as well. So it does cascade into other domains.
Yes. And I mean, I'm just going to I'm as an integrative learning specialist, I'm just going to ask you my questions of what I see, and also the concept of primitive reflexes. It's a controversial subject, isn't it? Some people say that no, you don't need to integrate it, and other people absolutely they need to be integrated because it's a developmental, one stage follows the next stage, follows the next stage, and it happens in utero, correct? Do you work with that?
So therapies that are dedicated towards targeting reflexes of sensory motor integration um, show the research shows that there's no evidence that there'll be improvements.
Hmm.
It's lacking empirical support. Um,
Hmm.
what has been shown to be highly effective for learning, for motor learning,
Yeah.
is having the child to be functional, having the child to do active movements, problem skill, challenging movements, and adaptive movements.
Yeah.
Therapy that is targeted towards those reflexes, even though they're still present at ages in which they shouldn't be, lacks empirical support.
I see. And what about sensory integration? What
Right.
about that? I mean, for example, let me just bring it down to concrete. This child was a cesarean birth, so
Mhm.
he never completed the movements that go along with getting out of the birth canal, right? And and so there is that in terms of primitive reflexes. And maybe you could explain what primitive reflexes are. And then so then he has no idea where his body is in space. Like, and he can't really imitate movements. It's almost like he can't contact that part of his body, even though he sees the modeling and he's developed enough joint attention, to observe what other people are doing, but it doesn't happen necessarily. And the PT said, yeah, he has a lot of difficulties with sequencing movements. Why? And how can we help him?
So, can you repeat the question again? Sorry.
So the question is, so basically, this child was a cesarean birth, and he did not complete the primitive movements, the motions that bring the infant out of the womb through the birth canal. So he missed that part altogether. Okay. It was a cesarean.
Okay.
And then he seems to be disconnected from his body. He doesn't know where his ears are, he doesn't know where his nose is, and he can't follow those gestures with heads, shoulders, knees, and toes. That it's just hard for him to follow those instructions or to move his arms in any way, like do airplane arms as he moves across the I-beam, in gym. There are certain things that he can't tuck, pike, and straddle his legs.
Mhm.
It's hard for him.
Mhm.
So can you speak to that and how teachers can support children like that?
Again, I am all for, it seems like this type of child would have lack of body awareness, right? Lack of perception of where he's in space and also of where specific areas of his bodies are, right?
Yes.
Um, that increased awareness happens through functional tasks, right?
Hmm.
Getting him to act with the environment into doing some meaningful actions, things that he's highly motivated in doing, things that get him to be engaged with the environment.
I see. Yeah. So basically, am I correct in saying that we're not doing the child any service by helping him get dressed, instead of slowly allowing him to get himself dressed, to find out where his head is and how to put his arms through the sleeves? Because as parents, sometimes we're in a rush. So we do everything for the children in order to get on with our life. And so maybe one of the functional tasks or some of the functional tasks are in daily living and
Right.
encouraging the child to do those things. Is that
Yeah,
what you're saying?
exactly, exactly. We're not doing them any help whatsoever. We're just doing it for him because that would mean that child is not actively engaged into doing the task within that environment. Of
Right.
course, you might need to guide the child at first or even provide some help, but the
Yes,
idea is to withdraw progressively.
correct. Okay, I understand. And so so a lot of emphasis in schools are on the child sitting still, right? Can you maybe for babies and infants, what are some of the movement breaks? And a lot of children are brought in strollers and taken away in strollers rather than walking, using their legs and so on. Are there any kinds of movements that you recommend that teachers could include in as mini movement breaks in school in during the day, to activate the body as a refresher, to get a little bit more energy into the system?
Well, school should implement, physical activity as many times as possible because they, yeah, I mean, they cannot be sitting for hours, and there's research showing how um, just walking and running and doing all these exercises then stimulates the brain even more when learning.
Right, right, right. Okay. All right. So, and then finally, I was going to ask you if you have any words of wisdom, any suggestions for parents or teachers that I haven't asked you about that you would like to say to them.
Um, you know, I want to first tell parents to enjoy, parenthood and don't be overwhelmed with everything that they hear in social media.
Yeah.
But second of all, just stay on top of things. Like highly recommend the CDC charts to see if their child are following their milestones at the ages in which they should be, and
Yeah.
establishing that connection with their doctors or therapists to really understand why we do things the way it should be done, so that they can be part of um, the goals that we want for their child if they're receiving services, for example. Um, it has been shown that when families are engaged and they understand what the reason is for doing services and they're motivated to continuing on the type of therapeutic goals that we do when we do therapy, there is vast improvements more beyond what we can obtain if just we come in silo and parents are not engaged.
Yes. And so in a way you're talking about helping the children be more part of their body, not just talking heads or brains, but be also connecting their body
Right.
with their brain, right? I mean, that general awareness for the parents. Would you call that a form of embodiment?
Yeah, absolutely. Yeah.
Yeah, yeah, yeah. Well, Jaya, it's been such a pleasure. Our time has come to an end, and you've provided us with so much valuable information. I can't thank you enough, especially the part where you said that the body's development has a huge bearing on our cognitive abilities, on our mental acuity. And so, thank you, and we'll talk soon.
So